Give me a minute. There seems to be, I'm having a little bit of difficulty in sharing my screen. Okay. Okay. You can choose to quit Zoom US now or do it in your own later. Okay. Is my screen visible to everyone?
Yeah, this is
Hello?
visible,
It's
yes.
okay. I thank Bharat Scouts and Guides heartily for giving me this opportunity to share my knowledge with you all. I'm very passionate about bridging the gap between what the doctor knows and what the patient should know. As the medical knowledge deepens and it becomes larger and broader, there is the gap between what the doctor thinks the problem is and what the patient thinks that he needs to be treated for is widening. And this is giving rise to a lot of problems in the society today, starting from mistrust. The mistrust between doctors and patients is the reason why there is so much of trauma, there is failure of treatment, and there is so much of litigations going on. And I feel that that has to be bridged. And in this way, I'm able to contribute a bit to my passion. So today I'll be speaking to you all about eye. What should we care about and why? Since I'll be speaking to a largely young population, I thought I will speak about briefly about structure of the eye, the refractive errors, which is the commonest and the largest reason for blindness in the entire world population today. And since you're all scouts and guides, very passionate about first aid, I thought I'll speak to you about injury to the eye and what is the first aid to that. Then in the changing times, with the lockdown and everything, all of our screen time has multiplied. So, and that affects the eye. So I thought I'll speak to you about screen time and the eye. Then, important, last but not the least, changing eye care scenario today in COVID situation. What is changing and what should we do about it? You can post the questions in the chat box and I'll be happy to answer it at the end. If my, if my speaking is not going to answer your questions, I'll be happy to answer at the end. This is the cross-section of the eye. The most importantly, why did I want to speak about the cross-section of the eye? Because the length of the eyeball, there are a few terminologies that I will be speaking, like retina and the fovea and the cornea and those things. So it is important for us to know where the various structures lie so that we understand what we are talking about and what we need to know. The red structure in the back is called as retina. The dark red one at the center that you can see here is the optic nerve, which takes the signals from the eye to the brain. This point over here is the center of the eye, which is called as a fovea. And fovea is the point where all the signals or the images which are focused on the fovea have the best resolution. That is where the vision is best. If the fovea is healthy, vision is good. If the fovea is not healthy, everything else, even if it's good, the vision is not going to be good. Then this curved structure that you are seeing, which is which is white, it's actually transparent. This is the cornea. This structure over here, which is slightly oval, this is the lens. The structure that is bluish in color in between the cornea and lens is the iris. This iris is the one that will give color to the eye. Different colors, black, brown, green, blue, is because of different pigments present in the iris. And with this background, let us go to the next part, that is the refractive errors. What's a refractive error? The eye has the ability to focus the light reflected from all the objects onto the fovea. That's the whole reason, that's the whole purpose of the way the eye is designed. And the light that is coming from various objects first gets bent in the cornea, then it gets bent at the lens, and then it is focused on the fovea. If this happens, then the person will have perfect vision. Suppose there is a problem in any of these problems, any of these structures, when the cornea is abnormal or the lens is abnormal or the eyeball is either too long or too short, then there is going to be a blurring of vision, and this type of blurring of vision is called as a refractive error. If the eyeball is too short, then the focus will be such that the focal point will be somewhere behind the retina. And the image that is formed on the retina will be not pinpoint, will not be sharp. And this gives rise to blurring of vision. This type of refractive error is called as hypermetropia or long sight. If the eyeball is too long, then the focal point will be in front of the retina. And again, the image that is formed on the retina will be blurred. So this type of refractive error is called as myopia, or it is also called as short-sightedness. In myopia, the person will be able to see the structures that are closer to him. Therefore, it is called a short sight. But the long distance objects are blur. On the other hand, in hypermetropia, the structures that are closer to him will be blurred, whereas the distant objects are fairly okay. Therefore, it is called as long-sightedness. The other thing that happens after 40, the lens has the unique ability to adopt its power to concentrate the rays on the retina. And this is what is responsible for us to see when we read. As we read, the lens becomes thickened, and therefore it will be able to focus from a shorter distance. So after 40, the lens starts losing the ability to focus. And this type of refractive error is called as presbyopia, or Charlesa it is called as. So what happens? So what if there is a refractive error? First, there'll be blurring vision. You can't see the objects properly. And that's the first and foremost, there'll be mistakes. This is very important. This becomes very important in children because they will lose confidence. And it is instrumental. There are a large population of children where the refractive error has gone unnoticed, unrecognized, and they are labeled as poor performers in school. This breaks my heart. This is very sad. Therefore, the government of India has launched large programs, school screening programs, to identify the refractive error at an earlier stage and give appropriate correction so that this problem can be solved in the beginning. When this loss of confidence is there, this gives rise to poor performance in school. This can spill over to work also in adult life. Another problem that happens is this can give rise to squint eyes, especially when the refractive error is different in the two eyes. If the refractive error is high in one eye and then it is lower in the other eye, or present in one eye, absent in the other eye, then this can give rise to squint. Presence of refractive error and presence of squint can give rise to problem called as amblyopia or lazy eye. So what is amblyopia or lazy eye? Refractive error in one eye is low, refractive error in the other eye is high. So the brain receives different images from the two eyes. It cannot combine that. Then what happens? The brain is very intelligent. It stops the image from the blurred eye. And it will start processing and responding to the stimulus from the good eye. If this part is corrected early, before 8 years of age, the brain can relearn to recognize the objects from the eye with high refractive error also. Suppose it is not done by 8 years of age, then brain can permanently stop recognizing the images from the eye with high refractive error. This condition is called as amblyopia. It's a little difficult condition to treat. So these are all the problems that are associated with presence of refractive error. Now, how do we treat? First and foremost, we should dispense the idea that wearing correction is an insult. It's not an insult. Just the way a person is tall or short, plump or thin or different skin colors, the eye also can be long or short. There can be some structural changes in the cornea or in the lens, which can give rise to various type of refractive errors. And wearing a correction is just like dressing or presenting yourself in a manner that is appropriate for you. So there is no shame in wearing a correction. So first thing, that the most important and the easiest treatment for refractive error is wearing of glasses. It is simplest, it is inexpensive, it is available everywhere, and that's the most effective method of doing things. Even before we move on to the next type of refractive correction, the first thing that everybody advises and we all advise is using glasses. Next is contact lenses. Contact lenses are aesthetically more pleasing than glasses, and the contact lenses needs to be worn and removed every day. There's a little bit of learning curve in using of contact lenses, but it is worth it. And there is a slight advantage of wearing contact lenses, especially in high myopia or high hypermetropia, because with high refractive errors, the central part of the vision will be very clear and the peripheral on whatever is on the sides will be slightly blurred. With contact lenses, this problem can be eliminated. Even when the person moves the eye, the person will have good vision. But with glasses, the patient will have to move the head itself to have good vision everywhere. Once these are exhausted, there is a recent development that has happened, which is called as refractive surgeries. The refractive surgeries are the most advanced type of treatment. The refractive surgeries are for adults. They are not for children. The patient should be more than 18 years of age, and the patient should have a stable refractive error. That means it should not change regularly. There are various types of refractive surgeries, and the type of refractive surgeries that is suitable for the person will be decided by the treating ophthalmologist. There are also a condition called as lens surgeries. That means if the refractive error is too high, then an artificial lens can be placed inside the eye itself. Or sometimes we remove the lens that is present, and we place an artificial lens in this place. This also is a possibility, but this is an advanced surgery, and there are very stringent criteria for us to select patients for these surgeries. What we should remember is glasses are the most inexpensive and the most effective treatment for refractive surgeries, and there's no shame in wearing them. Next, trauma to the eye. Trauma to the eye can be of blunt force, it can be a penetrating force, or there can be burns because of high temperature liquids, or there can be chemical injury. Chemical injury, alkali or acid. Blunt trauma can be with a fist, ball, stone, iron rod, these things. Penetrating trauma is where a metal piece or a wire, knife, nail is pierced into the eye. It reaches the structures of the eye and enters the insides. That's a penetrating trauma. Burns can happen because of high temperature, water, oil, and other liquids which are of high temperature. Chemical injury can be, as I said, alkali or acid. I'll show you a few photographs of different positions where the trauma to the eye has happened. And then I will speak to you about what is the first aid for these patients. This is a condition, or this is the eye of a patient who has sustained a burn. You can see that the eye, the cornea, or the black part of the eye has become white, and the conjunctiva, which is a protective layer for the eye, has stuck to each other. This is a burns patient. Chemical injury, this is acid or alkali. An acid or alkali burn is more dangerous to the eye than the acid burn. The reasons are quite extensive, but you should remember this. The alkali burn is more dangerous to the eye than acid burn. And of course, more stronger the acid or more stronger the alkali, more severe is the injury. That is given. And here, the surface of the cornea is breached. The surface of the cornea is sort of, what do you call it? It's peeled off. And that is what is looking in that color over there. Next, this is penetrating trauma. Here, something has actually gone through and slashed the eye, and the inner part of the inner structure of the eye is peeping out. This is a condition which is blunt trauma. That is, a ball or a fist has injured the patient, and that has given rise to collection of blood in front of the eye. This is blunt trauma. So what do we do? What's the first aid for these patients? First and foremost, in any case of injury, we have to look for and manage life-threatening injuries. Life comes first, then comes the eye. Then, any eye injury can be associated with injuries to the surrounding structures like face, cheek, or forehead, nose. That also needs to be treated along with the first aid to the eye. You know better, more than me, how to treat the various injuries, superficial injuries to the rest of the body. Next, whether there is a chemical burn or a thermal burn, we have to wash the eye with clean water or normal saline, which is available in the pharmacy. It is enough. There is no need to boil the water, cool the water, sterilize, nothing. No, nothing is required. Clean water is enough. Suppose that is not available, it is better, instead of using a dirty water, it is better to use normal saline from the pharmacy and give a wash to the eye. The amount of wash that the patient has taken in the beginning and earliest from the time of injury determines the final visual outcome of the patient, and therefore what you will do when you see a patient with chemical injury is of paramount importance. Next, if there is a blunt trauma, give cold compression so that the patient feels better. It's only comfort here, nothing else. The main treatment has to be undertaken by an ophthalmologist. If there is a penetrating trauma, there is only one thing that you need to do: patch the eye so that the internal structures are not exposed to the environment and they are not going to be infected. As much as possible, there should be less as infection as possible, and then quickly shift the patient to the hospital. So that will be the first aid in case of an injury to the eye. Next, screen time on the eye. Today, from the time of lockdown, everybody's screen time has multiplied. From software engineers to students, the screen time has increased. From doubling to becoming 10 times. Even we are speaking through a e-interface. And this has caused a lot of problems to the eye. How? It has given rise to sore eyes or irritated eyes, red eyes. Then, because of sitting in an abnormal posture, it has given rise to pain in the neck and the shoulders and the back, constant headaches, blurred vision or double vision. This happens if the near work, actually looking at a screen is near work. So if the near work has happened for such a long time that the eye muscles, the small muscles of the eye have become strained, and therefore there will be blurred vision. Then there will be increased sensitivity to light, increased sensitivity to dust or wind. And because of the same thing, which is uh, the irritation or strain to the small muscles of the eye, there will be difficulty in focusing. There is watering of the eyes and dry eyes. So this symptoms together are called as computer vision syndrome. What do we do for computer vision syndrome? There's something called as 20-20-20 rule, which means we should look away from the screen every 20 minutes for 20 seconds to an object that is 20 meters away, which means a distant object. As much as possible, look away from the window or look away from the door, get up and just walk around and come back about 20 seconds. And this is because 20 seconds is the time that is required for the eye to recover. We also have some apps, which are 20-20-20 apps available for the phones, iPhone, Android, and the Mac and the Windows and everything, which makes the screen go blank and you are actually forced to look away from the screen. One can use that, or one can consciously have the idea that a 20-20 rule has to be 20-20-20 rule has to be followed and can take care of their eyes. Suppose this is not enough, then we can give cold compressions. Dip a handkerchief in cold water and place it over your eyes. Or you can use some, cold compression, the pouches that we get, which is kept in the fridge and kept on the eye, that can help. Or we can use lubricants. Lubricants are available over the counter, no prescription necessary for that. And anything that comes with tears can be used as a lubricant. Suppose these things are not enough, then for further treatment, we need to meet an ophthalmologist. If this doesn't help, or if it's not enough, then one will have to meet an ophthalmologist for the necessary next level of treatment. Now, the eye care scenario has changed to a large extent today. What are the manifestations of COVID in the eye? These are all the questions that we all keep thinking and everybody wants an answer to. Yes, conjunctivitis is a presenting feature, but it is not the important feature, and it's a very rare presenting feature of COVID-19. There are a few retinal changes as well, but that is rare. That's not so important in this scenario. That's not so sight-threatening also. As of today, we don't know what happens next. We don't know what are the long-term manifestations of COVID-19. So what do we do? How is the eye care scenario changing? Video consultations are coming up. Are they really worth? Are they really important? And is it important for us to, can we actually do a video consultation for the eye? It is difficult to do a video consultation for the eye for the simple reason that when we look at the eye, we look at it through a magnified, an instrument that magnifies the eye, either through a microscope or through a slit lamp or through various imaging modalities. So it is very difficult for us to have appropriate video consultation in the eye. But we can use video consultation very intelligently to reduce the contact time between the patient and the doctor. Video consultations can help us to filter, which patient. First video consultation can help us whether we need to meet that particular doctor itself or a different specialty is required. So the actual consultation, the consultation that helps you, and the number of patient contacts that are required to achieve that result can be reduced. So you'll be directed to the appropriate specialist. So that is one thing that can happen. Second thing is, a lot of follow-ups can happen via video consultation. The first consultation will tell us everything that is required for us to know about the patient. And the follow-up will be whether the patient has understood the problem, or whether the patient is using the drops correctly, or there is any further drop in the vision, or there is any redness that is persisting. So these things can be done via video consultation. So that's the intelligent use of video consultation. And we can help ourselves and the doctors by avoiding routine consultations. Just one yearly consultation that can be avoided in the present scenario. Though it is not advisable, it is better. The routine consultations are advised in a non-COVID situation, especially in children, for us to pick up the refractive errors that can be troubling them. But it is not advisable at this point of time. But one must continue the necessary follow-up checkups, especially for patients who are having serious eye conditions, those patients who are on treatment, those patients who are taking injections, those patients who are having a problem in the eye, which are requiring either surgery or which is requiring another tablet or another injection. Such follow-ups should not be prevented. That such follow-ups should not be stopped, because once we miss the follow-ups, once we miss that continuity, the problem can worsen and we may need a higher level of intervention to treat these conditions. So current situation is not an unsurmountable problem for us. Like everything in life, this too shall pass and we shall adopt. Thank you very much. Thanks for your kind attention. I once again thank Bharat Scouts and Guides, Mr. PGR Sindhya, and all the other dignitaries for providing me with the opportunity to interact with you. Now I can, if there is any questions, I can answer them.
Thank you very much, Doctor. I think there are a few questions we will be able to take them.
Yes.
One question says, how much hours we can use mobiles? That is the question. How many hours of mobiles is better in a day?
There is no strict guideline as to these many hours are going to damage. Screen time is damaging for the eye, and the amount of time that you can restrict, if you're able to restrict it to a large extent, that's fantastic. But the problem here that we are facing today is not something that is that almost all our activities are happening through the screen, through the mobiles, through the laptop and everything. This is not something that is avoidable. And therefore, the distinction that we can achieve is we can reduce the amount of time we spend on laptops and mobiles and everything for entertainment, and we can replace it with the necessary things that we do on laptops, and use the guidelines that I have told before so that we can keep our eyes safe. Does this answer the question?
We have a next question. Is refractive errors going to be permanent?
Refractive errors is going to be permanent. Okay, that's an interesting question, because a hypermetropia is seen because of a small size of the eyeball, most commonly, though there are other causes. And as the eyeball grows, as the person grows, eyeball also grows. So there is a chance that a child with hypermetropia at a younger age tends to have a reduction in the hypermetropia as they grow, and they may become emmetropic. Emmetropic means that they don't have refractive error anymore. It is possible. But on the other hand, myopia, which happens because most common causes because of longer eyeball, as the person grows, it is possible that the myopia goes on increasing, and this is permanent. Yes.
The next question, doctor, is I have glasses for my myopia problem.
Mm-hmm.
How can we fix the myopia problem without glasses?
Myopia problem without glasses is, I told you that you can use contact lenses. You can use, there are refractive surgeries available, and there are lens surgeries available. That depends upon your refractive error, extent of refractive error, and the health of the eye, whether your eye is suitable for those intervention. There are certain conditions in which you cannot use contact lenses. There are certain conditions in which we cannot do refractive surgeries. So if those things are taken care of, yes, it can be corrected. It can be treated without the use of glasses.
There's one more question. This is related to contact lenses. I'm summing up two, three questions together, doctor. This
Okay.
contact lenses for how many days can we use?
Uh-huh.
And, will using contact lens damage the eyes or the eyeball?
Contact lenses are of various types. We have yearly contact lenses, yearly disposable ones. We have quarterly disposable, monthly disposables, daily disposables. And each of these lenses have different duration. Like, for example, daily disposable can be used up to 12 hours per day, and yearly disposable can be used only to maximum of 8 hours per day. Will contact lenses damage the eye? There are side effects which can happen because of use of contact lenses. But if the eye is healthy and it has been evaluated by ophthalmologist, you can definitely use. See, the contact lens themselves do not cause, but there are certain problems that are associated. Like, for example, it can cause a constant irritation to the eye, and it can cause itching. So some patients experience dryness while using contact lenses. Not everybody. Some patients experience dryness. We have seen patients who have developed infections because of using contact lenses. That is primarily where they have not maintained the lenses properly. So all these problems are present during all these are the problems associated with use of contact lenses, but by and large, contact lens use is safe.
Doctor, there's one more question. Again, I'm summing three, four questions together.
Sure.
What is the remedy for eye burning, forehead paining, and itchy eyes? And can you suggest any good eye drops for redness of eyes? And the question, fresh tears, is it okay?
Yes, refresh tears is something that you can use over the counter, and that is available over the counter. You can definitely use it safely in any condition. I don't say you should not use it for any condition. You can use that. And if it does not solve your problem, please meet an ophthalmologist, because first thing that we will look for is the thing that you are looking for, whether if you are having itchy eyes, red eyes, is whether you are having a computer vision syndrome. Are you going to have are you having this irritation because of increased screen time? So these things are not there. If these things are there, the lubricating eye drops is going to solve the problem. If it is not solvable by lubricating eye drops, then we have to evaluate you thoroughly to identify what is the cause, because itchy eyes, red eyes, and irritation, everything can be because of many causes, much more sinister than computer vision syndrome.
We have one more interesting question which says, ma'am, after undergoing cataract surgery, can we do heavy exercises like running, jogging, etc.?
First few days after cataract surgery, no, but after 1 month of cataract surgery, you can do anything you want.
Doctor, is there any eye exercises you can suggest to improve our vision?
No, we don't have any eye exercises to improve the vision. There are eye exercises to, there is a condition called as asthenopia. So we have eye exercises to help that. There is an eye condition where our accommodation is poor. So we have exercises to improve the accommodation. Then there are a few exercises that are there to treat amblyopia. I spoke to you about amblyopia before. There are a few exercises that are there to improve the amblyopia. But if you're talking about improving the eyesight with refractive error, no, we do not have any exercises for that.
This is about glasses. What questions are coming like, is blue light glasses good for use? And modern days, there are so many goggles and sunglasses. Is it good to use or is it problematic?
No, you can definitely use. Why not? Cutting down the sunlight is good for the eye, so you can definitely use these. These, commonly these things are called as blue cut lenses. That is what is generally called in. That's what people call colloquially blue cut lenses. So blue cut lenses is a recent thing that has come in. So they say that they reduce the amount of harmful blue light that enters the eye from the screen. So yes, they are they are useful. We have seen some patients reporting that they have less strain when they use those glasses.
Doctor, this is quite interesting.
Mm-hmm.
This girl is telling that our grandmothers advise us to use kajal or eyeliner to keep the eyes cool. Is it really recommended to use?
Um, See, kajal is actually no. There is no relationship between use of kajal and keeping the eye cool. Okay, kajal improves your beauty, so please use it as a beauty supplement and not as an idea to keep the eye cool. There is a problem that happens by using kajal. We apply kajal at the margin of our eyelids, upper and lower margin of our eyelids. And that is the point where we have the openings of certain glands that keeps our eye moist. And when we apply kajal continuously, these glands are blocked. And this can give rise to dry eye problems in some patients. So my suggestion would be not to use kajal continuously, use it sparingly and use an eyeliner. It'll make you beautiful also.
Doctor, last two questions and we will close it there. And this
Okay.
question is about what are dry eyes?
Dry eyes are a group of condition that happen because of incomplete or insufficient tear layer on the eye, on the surface of the eye. The tear layer is actually made up of three layers. It is made up of the aqueous layer, that's a watery layer, and the middle layer, and middle layer is little consisting of mucus, and the inner layer which is consisting of the oily substances which are secreted from the lid margins. So decrease in secretion of any of these substances or an increased evaporation of these tear layer is responsible for a condition called as dry eye. And there are many reasons why this happens, and continuous use of computers and increased screen time is one of the reasons why it happens. That happens in this condition. The reason is increased evaporation, because we forget to blink, and we continuously look at the computer without a break, and there is an increased evaporation of the tears, and therefore increased screen time causes a decrease in it's one of the causes of the dry eye. There are many other reasons for dry eye, and those reasons have to be evaluated and treated by ophthalmologists.
Doctor, this is an interesting question. It says,
Mm-hmm.
Doctor, my eyelashes keep blinking continuously. Is there a problem? It happens quite often with me.
Eyelashes, I think you mean to say eyelids.
Eyelids, yes, I think so. That should be eyelids. The question,
Okay. Increased blinking sometimes is a problem, sometimes it's not a problem. And it is called as benign blepharospasm. It is called as, there are various conditions. One of them is blepharospasm. If it is benign, if it is associated, why does the eye blink? It blinks because the neurons in the eye, the nerve endings in the eye perceive that there is some irritation that is going on in the eye. So to remove that irritation, the eye continuously blinks and water is produced to keep the eye comfortable. So if the eye blinking is there uh, because of any of these reasons, then treating of these conditions will remove the blinking of the eye. But if it is because of a neuronal condition, certain neuronal condition can also cause this problem. If it is because of a neuronal condition, then that has to be treated in a different manner.
thank you, doctor. By now, I think we have answered almost all the questions. Thank you for your valuable time. Now, I request our State Chief Commissioner for his closing remarks. Sir,
Thank you very much for giving me an opportunity to interact with you all.
Sindhya, sir. One second, sir is joining. Sir, unmute ಮಾಡಿ sir. Yes, sir. You can speak, sir. Sir, ಮಾತಾಡಿ sir. It is your time to speak, sir.
You're asking me to speak?
Yes, sir.
Mugita?
ಮುಗೀತು sir. It's over, sir.
No, all questions answer ಆಯ್ತಾ?
ಆಯ್ತು sir. ಎಲ್ಲ question answer.
ನಾನು ಮಾತನಾಡ್ತಕ್ಕಂಥದ್ದು ಹೆಚ್ಚಿಗೆ ಇಲ್ಲ. ಡಾಕ್ಟರ್ ಶ್ರೀಲಕ್ಷ್ಮಿ ಶ್ರೀನಿವಾಸನ್ ಅವರು ಬಹಳ ಚೆನ್ನಾಗಿ ಎಲ್ಲ ವಿವರಗಳನ್ನು ಸಹಿತ ಮಕ್ಕಳಿಗೆ ಕೊಟ್ಟಿದ್ದಾರೆ. ಸ್ಕೌಟ್ಸ್ ಗೈಡ್ ಉದ್ದೇಶವಾದರೂ ಒಂದು ಆಲ್ ರೌಂಡ್ ಪರ್ಸನಾಲಿಟಿನ ಮಾಡಬೇಕು ಅಂತಕ್ಕಂಥದ್ದೇ ನಮ್ಮ ಉದ್ದೇಶ. ಅದರಿಂದಾಗಿ ಅದು ಕಣ್ಣಿರ್ಬೋದು, ಮೂಗಿರ್ಬೋದು, ಬಾಯಿ ಇರ್ಬೋದು, ಇತರೆ ಕಾಯಿಲೆಗಳಿರ್ಬೋದು, ಕಿವಿ ಇರ್ಬೋದು, ಕಾಲಿರ್ಬೋದು, ಎಕ್ಸಸೈಸು, ಫುಡ್ ಹ್ಯಾಬಿಟ್ಸು, ಪ್ರತಿಯೊಂದು ಬಗ್ಗೆನೂ ಸಹಿತ ಒಂದು ನಾಲೆಡ್ಜ್ ಇರಬೇಕು ಅನ್ನೋ ದೃಷ್ಟಿಯಿಂದಾಗಿ ಇದು ನಿಮಗಷ್ಟೇ ಉಪಯೋಗ ಆಗೋದಲ್ಲ, ನಿಮ್ಮ ಕುಟುಂಬ ವರ್ಗದವ್ರಿಗೆ, ನಿಮ್ಮ ಸ್ನೇಹಿತರಿಗೂ ಉಪಯೋಗ ಆಗ್ತದೆ ಅನ್ನೋ ಉದ್ದೇಶದಿಂದಾಗಿ ನಾವು ಈ ವೆಬಿನಾರ್ಗಳನ್ನ ಪ್ರಾರಂಭ ಮಾಡಿದ್ದೇವೆ ಕೋವಿಡ್-19 ಸಂದರ್ಭದಲ್ಲಿ. ಇದು ಕಂಟಿನ್ಯೂಸ್ ಆಗಿ ಮಾನ್ಯ ಮಧುಸೂದನ್ ಅವರು ನಡೆಸ್ತಾ ಇದ್ದಾರೆ. ಅವ್ರಿಗೆ ನಾನು ಅಭಿನಂದನೆಗಳನ್ನು ಸಲ್ಲಿಸ್ತೇನೆ. ಮುಂದೂ ಸಹಿತ ಮುಂದುವರಿಸ್ತದೆ. ತಾವುಗಳು ಸಹಿತ ತಾವು ತಿಳ್ಕೊಂಡಿರ್ತಕ್ಕಂಥ ವಿಷಯಗಳನ್ನ ಗ್ರಹಿಸಿ ನಿಮ್ಮಲ್ಲಿ ಅಳವಡಿಕೆ ಮಾಡ್ಕೊಳ್ಳಿಕ್ಕೆ ಪ್ಲೀಸ್ ಟ್ರೈ ಟು ಅಡಾಪ್ಟ್ whatever you have learned from Dr. Sri Lakshmi today. She is a great leader. She is not only a specialist in eye problems, eye related problems. She is from an illustrious family of scouting. She is a very disciplinarian. That way, whatever she has said, that you try to adopt within yourselves and also try to share with your family members. The knowledge of the intention of scouting guiding is to make every youth of this country, every youngster of this country, every citizen of this country is more knowledgeable, more informative. That is what we are trying to do through this webinar. I am grateful to Sri Lakshmi Srinivasanji for given her valuable time for us. I am sure thousands of people will be benefited by this webinar. I request her to come be with us because she is part of our scouting family. I am 100% confident whenever we invite her, she comes. I am also grateful to Mr. Srinivasan, one of the senior most leaders of scouting guiding movement in this country and also in Karnataka particularly. He was devoting all his time, not only intellectually and also physically whenever we call for. This is the greatness of this great family of Srinivasan. Madam, I am highly obliged to you. Thank you. I wish all the best. And to all the participants, I wish that during this COVID period time, you take precautions for yourself, protect yourself, stay home, stay safe. All the best. Thank you. I conclude my concluding remarks with a scout salute. Thank you.
Thank you, sir. Thanks for the opportunity.
Thank you very much, sir. Thank you, Dr. Sri Lakshmi. And thank you for all our scouts, guides, rovers, rangers, and our unit leaders for being part of it. Thank you, one and all. The webinar comes to a close here. Thank you.
Thanks.